This episode is sponsored by ByHeart. At ByHeart, their goal is to create a future where all parents feel amazing about feeding their baby, no matter how they do it. We know that breast milk is best, but for those of us who have difficulty breastfeeding like I did, or choose not to breastfeed, you want a great alternative, and that's why I am so excited to tell you about ByHeart. ByHeart's patented protein blend gets closest to breast milk by including the two most abundant proteins in breast milk. They even ran a clinical trial where they compared their formula to a leading infant formula and found benefits like softer poops, less spit up, and easier digestion. ByHeart also supports brain and eye development, immune health, and gut health. This company is leading the way. They are the only US-made infant formula to use organic, grass-fed, whole milk, not skim, and they are the only new infant formula brand to add a comparison to breast milk so that they can best understand their closeness to nature's most superfood and all of the magical benefits of breast milk. Curious if ByHeart is right for your baby? New customers get 10% off your first order with the code Dr. Nicole at byheart.com/podcast. That's 10% off your first order at byheart.com/podcast. This is a limited time offer. Additional terms and conditions apply. So here's the truth. Your due date is a terrible predictor of exactly when you will give birth. Welcome to the All About Pregnancy and Birth podcast. If you're having a baby in the hospital, you are giving birth in a system that too often takes away power from women over what happens in their own bodies. I'm Dr. Nicole Calloway Rankins, a practicing board-certified OBGYN who's had the privilege of helping well over 1,000 babies into this world. I've been a doctor for over 20 years, and I'm here to help you take back your power, advocate for yourself, and have the beautiful pregnancy and birth that you deserve. This podcast is for educational purposes only, and it's not a substitute for medical advice. Check out the full disclaimer at drnicolerankins.com/disclaimer. Now let's get to it. Hello there, and welcome to this short episode of the podcast. Whether this is your first time listening or you've been here before, I'm so grateful you're spending some time with me today. Let's chat for a minute about due dates. One of the first things that will happen when you start prenatal care is that you'll be given a due date. It's usually based on the first day of your last period, or it may be based on the earliest ultrasound you had, whichever one that we determine is the most accurate. So what is a due date important for? Well, due dates are actually really important. We use the due date to track how far along you are in your pregnancy, so we can make sure your baby is growing as expected and that we do tests at the appropriate time. So for example, if you're 30 weeks pregnant, we want to know that the baby is the size that we would expect at 30 weeks, and especially not too small, because a small baby is a sign that the baby may be in an environment where they can't grow well, where they're not thriving. And if we hadn't established how far along you are, then we can't determine what the appropriate size of the baby should be. So that's a really important reason to have an accurate due date. Due date is also important to do tests at the appropriate time. So for example, the 18 to 20 week ultrasound, that's the best time that we have right now in order to look at all of the structures of the baby. Although I will say that is moving up a bit. We're actually trying to start doing more detailed ultrasound in the first trimester. We're not quite there yet in terms of that being rolled out for everyone, but it's getting there. So right now we do that ultrasound around 18 to 20 weeks to look at all of the structures. We also do the glucose test at 24 to 28 weeks. We do the GBS test at 35 to 37 weeks. So it's important to know how far along you are in your pregnancy, so we do those tests at the appropriate time. And speaking of prenatal tests, if you want to know about all of the tests that are done in pregnancy, broken down by trimester, broken down by, blood tests, what type of test it is, why the test is done during pregnancy, because we don't always do a good job of explaining like what tests we're doing and why. Sometimes it's like, oh, just go get this test, go get that test. If you want to have a thorough explanation of why those tests are done, check out my free guide. It covers everything in that guide. It's drnicolerankins.com/prenatal. Just pop in your email address and I will shoot that guide your way. Now, getting back to due dates, did you know that only about 5% of women give birth on their actual due date. Yes, you heard that right. Only 5%. So really what we should do is, instead of giving people a due date, we should really give people a range of dates that you will probably have your baby. And that range should actually go beyond the due date, because a good number of people will go past their due date, especially for your first baby. That would be a way more accurate way to present things. If you're thinking about where to get items for your nursery, this message is for you. As you prepare for the beautiful journey ahead, let Home Threads be your partner in creating a serene nest for your growing family. At homethreads.com, explore a collection designed for comfort and style during this special time. From cozy nursery essentials to soothing rocking chairs, they've got everything to make your home the perfect haven for your little one. We got a gorgeous floor lamp from Home Threads that is the perfect addition to a reading nook in our home. This lamp would also be absolutely perfect over a rocking chair in a nursery. That's one of the things I like about the items at Home Threads. You can find quality items that will not only be perfect for your nursery, but if you want, you can later move them to other areas of your home where they will also look just as perfect. Visit homethreads.com/Dr. Nicole today and receive a code for 15% off your first order. Home Threads, love where you live. So looking at it in a bit more detail, looking at data from the Centers for Disease Control and Prevention, and this is from 2021, that's the most recent data that's available. For the almost 3.7 million babies that were born, about 10% came preterm, so that's before 37 weeks. About 29% were born between 37 weeks and 38 weeks and 6 days. 56% were born between 39 weeks and 40 weeks, 6 days. And then 5% were born between 41 weeks and 41 weeks, 6 days, and less than 1% at 42 weeks or beyond. So roughly 95% of babies will be born by 40 weeks and 6 days, okay? So don't get attached to that due date. In fact, we actually, in the chart, we refer to it as an estimated due date. We just don't do a very good job always of explaining that to folks, that it's actually an estimated due date and not an exact date for when your baby will be born. And then another thing I want you to know about your due date is that your due date does not change as you go through your pregnancy. This is something that I see people get really confused about if they get future ultrasounds in pregnancy. The first trimester ultrasound, the date that we determine in the first trimester, is the most accurate for determining your due date. And that will be the due date that we use throughout the remainder of your pregnancy. Now, not infrequently, you'll get an ultrasound. It could even be the 20-week ultrasound, or maybe it's an ultrasound in the third trimester, and it may have a due date on it based on the measurements of that ultrasound that are slightly different than the measurements from the first trimester ultrasound. Your due date does not change because of that. The further along you get in your pregnancy, the less accurate ultrasound is at estimating due date and how far along you are, so we don't change it. So if you get an ultrasound report that says, oh, estimated due date is a date that's different than that first trimester ultrasound, you always stick to the date that was established in that first trimester of your pregnancy, or the earliest point that you had prenatal care. The earlier you establish it, the better. Now, I take a deeper dive into due dates in episode 147 of the podcast. So you can check that out, drnicolerankins.com/episode 147. So there you have it. Please share this podcast with a friend. It helps me to reach and serve more people. I'm on a mission to reach and serve as many pregnant folks as I can, and I would so appreciate your help in doing so. So please share the podcast with a friend. Also, subscribe to the podcast wherever you're listening to me right now. Number one, you will never, ever miss an episode. And when you subscribe, you can also leave a review in Apple Podcast. I know that's where most folks listen. If you leave that review, it helps other women to find the show, helps the show to grow. And I so appreciate hearing what you think about the show. You can also let me know what you think about the show over on the gram. I'm on Instagram at Dr. Nicole Rankins. Shoot me a DM. Let me know what you think about the podcast. Let me know about any topics you're interested in. Let me know if you had your baby on your due date. I'm curious. Let me know. All right, so that's it for this episode. Do come on back next week and remember that you deserve a beautiful pregnancy and birth.